Hi, everybody. This is the second lecture for Module 8, Week 8. We started out with epidemiology, and we're going to continue on kind of talking about transmission of disease. So I'm going to go ahead and go to my PowerPoint. In this particular mini lecture, we're going to be talking about the two categories of viral transmission, and we'll come up with an example of each, like how they could be transmitted. We're also going to talk about this idea of herd immunity. And you may have heard it as we've kind of been living through this pandemic, of the idea of having enough people in a population who are immune to a disease so that those that are not immune in the disease can't catch it. And I'll talk about kind of the importance of vaccines as well with that. We'll also talk about different ways that public health officials can prevent or contain contagious diseases. These used to be terms that I felt like were less familiar to the public, but having lived through this pandemic, they're probably fairly familiar to most of you. For vocabulary, we'll talk a little bit about direct and indirect transmission. We'll talk about what are vectors and vehicles. We've talked some, but we'll talk again about portal of entry and exit, and then herd immunity, quarantine, and isolation. So when we think of modes of transmission, we think about how a virus gets into a host or how it goes from wherever it was into that host. So when we think of a direct transmission, what we mean is that that virus passed with direct contact, physical contact from person to person. So in general, this can be things like contaminated hands, like if you have a rash or something and then you touch somebody, that would be that direct contact. Sexually transmitted diseases are through sexual contact, right? Kissing, saliva, or any other secretions where we could pass it in a direct touching manner would be considered direct transmission. Indirect means that there is something that is transferred or carried by either an intermediate, and that could be an insect or maybe something that you actually touch or the air. So when we think of indirect, we think of maybe somebody coughing into the air, that virus becomes airborne, you then breathe it in. You didn't have direct touching contact with them, but you still got the virus. For vectors like mosquitoes or any kind of insects, we would expect, again, that is something that's kind of the middleman, if you will, between the person who is infected and the person who they infect. Then we can think about things like ingestion. If somebody was infected and they prepared your food or your water and it got contaminated, you wouldn't have to actually be in contact with them to actually catch it from what they had handled. And then lastly, we can think about as vehicles. And we often think about things like pens or pencils that maybe somebody coughed on their hands, they touched it and then you touched it, or a doorknob. Or maybe we can also think about needles and shared needles. So indirect means that you don't have actual physical contact with the person that you're catching it from. Direct means that you do. We can think of the chain of infection thinking about how we could break that. So often in hospitals, what we think about with control and prevention is where is the portal of entry, right? Is it something that it's coming in through the respiratory tract? How do we prevent that? Is it something that's through direct contact? We can also think of the portal of exit of how is that being spread? Is it being spread respiratorily, that people are coughing or sneezing? Or is it that they have a rash and things are sloughing off of their skin? Once we know how it's leaving the infected person and how it could gain access to somebody who's uninfected, we can break the chain of infection by stopping that transmission. And so that's something that's looked at very closely by hospitals. The next thing I want to talk about is herd immunity. And I mentioned this in the intro of this idea that when we have some sort of disease that's circulating through a population, if there are less people who are susceptible or who could catch and then transmit that disease, we can protect other people around us, right? So one of the things that we can think about if we look at this is that in this, what we're showing is that if the majority of a population, and in this case, it would be all the blue, is immune, whether they've had an infection and have immunity in the natural way, or maybe they've been vaccinated against something, what we see is that we could have an infected person who can spread it to those who are susceptible. But if we have enough of a percentage of the population that's immune, what happens is that it can't spread very far, meaning that even though it might have spread to these people, Because these were surrounded by immune people, it ends there. Now, if we had a lot more yellow people here or susceptible, we can imagine that it would spread much more quickly and throughout that population. And that's where we ran into the problem with SARS-CoV-2. It was a novel virus, meaning nobody had had natural exposure or natural immunity to it. In addition, nobody was vaccinated against it. So in the case of SARS-CoV-2, when it emerged in late 2019 and early 2020, we would look at this map of kind of these people and everybody would be yellow. Everybody would be susceptible. Nobody would have immunity. So with that, that's kind of what we think about. This is what it would look like now. This probably is what it looked like more kind of in spring or summer of 2020, was that there were some people that were immune from natural immunity for a period of time, right? We know now that it's a limited immunity. But because there were so many susceptible people, it could move throughout that whole entire population. And that's really what we're looking at when we're trying to get vaccination levels up to a certain percentage, is that we could then protect people better. But this gives you some concept of herd immunity. And we really think about it as, if you're somebody who's healthy and you have no reason not to get the vaccine, we would expect that you get the vaccine. Not so much, part of it would be to protect you, but it would also mean that you are stopping the spread of it to those people who can't be vaccinated. So many times very young children cannot get all the vaccinations. Pregnant women cannot get all vaccinations. And the immunocompromised, even if they're vaccinated, often can't mount an immune system. And so when we think about getting our vaccinations, I often think about it first that I'm protecting those around me, and then that it's also protecting me. So kind of something to think about with that herd immunity. Lastly, I want to kind of revisit that the first lecture of this week, which was that epidemiology, and talk about what it is, if we're an epidemiologist, we want to know. The first thing is we want to know what is going on. What is the particular disease, right? So identify what the disease is. Then who, which people are getting it? Is it more the elderly or more the young, or is it affecting everybody equally? We want to know that. Where are people getting this? Is it indoor? Is it from a water source like cholera? Is there a particular time of year? Like we know with influenza, we typically have surges during the winter. COVID is one of those weird ones where normally we think of respiratory diseases as the surges being in the winter, but we've often had surges in the summer. And so we want to know the times. And then risk factors. How and why are people getting infected? Is it that they're in indoor environments? Is it that they're doing risky behavior? They're not washing their hands. They're using needles, right? That they're using injectable drugs. All these things are things that epidemiologists want to know, because if we know these things, we can come up with plans to then prevent it from spreading. Excuse me. Speaking of, good thing everybody's online. So epidemiologists with this knowledge allows them to break that chain of transmission. So how do we go about looking for disease and then doing something about it? Generally, what we do is we do what's called surveillance, and this can happen in a number of different forms. The first is that we can do monitoring data from mandated reports. So many physicians and clinics have to actually report on certain diseases, the number of people who are infected, so morbidity, and how many people are dying. That usually is collected at the county level, then that goes up to the state, and then often we combine that with the nation to kind of see where problem areas are. We often have active field surveillance as well, and this is especially true of viruses that are spread by insects. So often they'll catch mosquitoes in areas where we might have seen like West Nile virus, and then test those mosquitoes to see if they actually are carrying that disease. And then we can do serological screenings of the population, meaning that we can take blood samples to see if there are antibodies that show somebody who is exposed to a particular disease, or perhaps not only exposed, but now protected from that disease. So once we know this, what are some of the ways that we can actually think about preventing and containing contagious diseases? So some of the ones that we have are quarantine. So meaning if it's a short incubation period, we could hold people that we think were exposed past that incubation period to make sure that we're not turning them loose in the general population. Isolation would be when you are ill with something that's contagious, that you isolate yourself from susceptible people until you're past that contagious period. There's been a lot of progress made, and this was specifically used in Ebola epidemics in West Africa. The idea that if we could do quarantine and isolation, we could basically stop it from spreading to greater areas. But we also saw that with SARS-CoV-2, right? That we can do quarantines and isolation. Another big part of epidemiology is education, just letting people understand kind of the disease, the risk factors, how to prevent it. So again, quarantine is segregating from the general population, healthy people who aren't ill, but may have been exposed and we're worried may get that communicable disease. We've used these throughout history, and often this involves cooperation of health agencies, often kind of our health districts and government organizations, to make sure that we hold these people apart until they are outside of the incubation period to see if they actually have the disease. Isolation, as I said, refers to people who are ill, so have the disease and are contagious. And it's that we isolate them from healthy individuals until they're past the disease. This has been done for measles, but we also have done this with COVID as well, right? If you test positive, we usually have an isolation at home for a period of time. It used to be that you would test out of isolation to then be around people who are susceptible. That ends with our checking in. So please feel free to pause this and go ahead and answer the questions before you bring it back and go through it with me. So for the checking in, the first question is, what are the two categories of viral transmission? And we would say that that would be direct contact or indirect contact. Name a virus that is transmitted directly. We can think about Ebola is transmitted directly. You have to have very close direct contact with a person who has the virus to actually catch it. A virus that we can think of that is transmitted indirectly, the common cold. We could think about influenza and SARS-CoV-2, which are all airborne, right? What does herd immunity mean? Herd immunity means that if enough people within a population or community have immunity, that they protect those within the population from getting the disease because it has no way to transmit throughout the population. And then the last question is, what is the difference between quarantine and isolation? Quarantine is referring to people who we think have been exposed but are not yet sick until they're outside of that incubation period. Isolation means the person actually has the disease and is in a transmissible state. We want to keep them separated from the general population until they're no longer contagious. Hopefully that was helpful. If you have any questions, please let me know. Thanks, you guys.